wouldn't mind just switching your camera off for the duration of the recording, so that your deep paste doesn't go onto the recording. We will edit that out anyway, but it would also just save a little bit of bandwidth for people to be able to get a better signal as well. Other than that, if you do have any questions, if you wouldn't mind just entering them in the chat, and we'll try and answer those. I think Kat, if you wouldn't mind just picking out any questions, because I can't see the chat at the moment. Someone does have the microphone on. If you wouldn't mind, please switching it off. That would be brilliant. Thank you. Everyone's coming in now.
Mirren, do you hang on a second?
Sorry, could you switch your microphone off? Thank you. Okay, so just so you're aware, all of our masterclasses are recorded, and the slides will be made available for you through our Learning for Professionals page, but also on our YouTube channel. This recording will be made available. It will take a couple of days probably to get it up there, but just keep an eye out for it. And if you want to subscribe to our YouTube channel and click on the bell icon, then you will be notified when any new videos are uploaded. And also, following the course, if you wouldn't mind completing a post-course questionnaire on NYES so that you can get your attendance certificate as well. So, multi-agency audit reports. The NYSCP undertakes a series of multi-agency themed audits per year. As a matter of fact, we take 3 different themes. Sorry, could somebody please switch the microphone off? Thank you. Each audit undertakes a deep dive audit on 4 children, so we do 1 audit per month on average, although we don't do an audit during August. So 1 month we do double up, as it were. The themes are identified from the information from a variety of different sources that we have in the partnership, which will also include national learning, regional learning and local learning that we have derived, anything that's newsworthy, that sort of thing. And terms of reference for every audit is then created, which identifies the theme of the audit and what key questions that we're seeking to answer for the cases to be reviewed in each child. We then select 4 children at random, and where possibly 1 from each quarter of the county, so that we can't be, it's more fair that way. So we're not concentrating on, say, Scarborough or Harrogate or Selby or North Allerton area. And depending upon the nature of the audit, a child in each of the categories of early help, child in need, a child subject to a child protection plan, or a child in care will be looked at as part of that as well. That's not always possible, either because of the theme of the audit or just because we have a very low data set because of the area that we're looking at, and there just isn't the children that we can actually select from that sort of pool. But we do try and make it reflect that sort of list of children. All partners who were connected with the child and the audit theme and the referral are invited to take part in the audit. Any schools who are involved with the child, any nurseries, anything at all, they would be invited to that audit process. Sorry, could you please switch your microphone off? Thank you. Partners are sent a form for completion, basically undertaking a single agency sort of review, and then we combine those and share all of those out to everybody who will be attending the audit meeting. A multi-agency audit meeting is then held, and all partners who are connected with the child and the audit theme or referral are invited to attend that meeting. And we've had a number of people like, sorry, somebody's got the microphone on, can you please switch it off? Thank you. So if you've got your microphone on, can you please switch it off? Thank you. A multi-agency audit meetings held, and as a result of that, we will bring in any partners who have been involved with the child and have a what we call a deep dive audit discussion. At the end of the process, the learning from the audits is put into a thematic report. We don't talk about the individual children per se. We look at the themes that have derived from that, and we produce a presentation and for the learning improvement subgroup, and the identification of any relevant actions that we might want to take, and then the subgroup will identify an action plan from that and approve it, and then it will be monitored through the learning improvement subgroup of the partnership. Multi-agency learning is also shared on our website on the Learning for Professionals page, and then learning is obviously shared through Masterclasses and other training as well. So this one is obviously linking into all of that. The theme deep dive audits which have been completed recently are the multi-agency responses to children who were repeat child protection plans, for children who are on the Autistic Spectrum Disorder, and multi-agency responses to children experiencing neglect. So when we're talking about the repeat child protection plans audit, here we were looking at child protection plans are made when a child is thought to have suffered significant harm or is likely to suffer significant harm if things don't change. And a child protectionist conference is held where there are concerns that a child may not be safe or where their needs aren't being met. There are important considerations for professionals when looking at a child protection plan. These will include things like the time since the last plan ended, where it's a repeated one, how long the previous child plan was running for, an evaluation of why the threshold for significant harm has presented itself again, and whether the risks in the referral were the same or different concerns that were addressed in a previous plan. If the circumstances posing a risk to the child are identical, it could be considered that the previous child protection plan ended too soon, before the improvements to the child's welfare had been fully established. Repeat child protection plans may be more complicated, and if the risks and circumstances are identical to the child protection plan, the RCPC, as otherwise known, will need to identify what went wrong with the arrangements that had been put in place originally with different services, the actions and the support that's available that wasn't offered with the previous plan. So there's a lot of considerations here for repeat child protection plans. And what the audit found out, the areas that we looked at that were working well, were things like case recording. Here we discovered that changes in the new module in the Children and Families Service case management system has improved plans and brings together actions like contingency plans and trajectory plans. Home assessments were also another area of good practice. Here we were looking at the good practice using the Home Environment Assessment Tool, or HEAT tool as it's otherwise known, that help practitioners be specific about and identify early signs of neglect, as well as actions to take to address and support the family in the home conditions and say, ensure their safety. So the HEAT tool is a tool that is available to all practitioners, and it's available from our website. Just go to safeguardedchildren.co.uk, and on that page you can just do a search for the HEAT tool and you will find that. We also found evidence of good working together with joined up working across several cases, and examined a joint multi-agency working, which included well-established multi-agency meetings. There was also good evidence of working with families. The work from the Children and Family Service, who were reported to be supportive, and noted good work by the social worker in one case as well. Voice of the child, there was evidence that this came through, so that children were being listened to and taken into account in terms of the assessment and the planning for the child, which is obviously good as well. And also information sharing. Here we did see evidence that professionals are aware of the need to share information, and that sharing was handled well across all of the cases that we examined. There were, however, areas that we found required further improvement, because we are not only looking for what worked well, but what we need to change. And professional curiosity is a very common theme that we find in a lot of these audits. So what we really need to do here is remind professionals that there is a need for professional curiosity in ensuring that cases don't become subject to drift. And we have guidance to support professionals in relation to professional curiosity that's available from our website. Police protection orders. The Children and Family Service and the North Yorkshire Police, it was identified, should review processes to ensure that where a child protection order is obtained, any safeguarding investigations taking place should be informed of the outcome to ensure that the multi-agency processes are aligned, because this hasn't been the case in one or two of the cases that we looked at. Changes of professionals as well. Obviously, it's important to recognise that in some cases, the changes of professionals or having too many professionals involved with a family may have an impact on either the willingness for the family, including parents and the child, to engage, or their capacity to be able to engage as well. So we need to be very cognizant of not overwhelming families with many different changes in who is supporting them. Another thing that was identified was the involvement of midwives. So here we identified that midwives should be involved in cases where there is an unborn baby, and a pre-birth assessment should be informed of the outcomes of that. We have new guidance in relation to unborn babies as well. That's available on our website. And it's important that a birth plan is developed in a timely fashion and shared with maternity units. The last area for development was in relation to violent offenders, and where there are concerns about a person who is a violent offender, the risks to be identified as part of that assessment and planning process should be made. And this also included things like Clare's Law should also be considered where such a disclosure is relevant as well. So what have we done as a result of that? Well, we've put in place a lot of practice guidance, including, as I mentioned before, the one about professional curiosity. And there is an action plan in relation to this audit as well. And all agencies involved in the audit have received feedback regarding the good practice and the areas for development. We also have produced a 7-point briefing, which is available for everybody to see the highlights of the audit report. So the resources that link in with this particular theme, obviously this links to the framework for decision making, the right help at the right time by the right person. That does identify the thresholds. It is the threshold document for North Yorkshire. Making sure that people in your organisations are aware about the Worried About a Child page on the NYSCP website, because that does provide you with details of how to make a referral. The NYSCP standards and criteria, which have been updated, because that outlines all of the requirements for everything from a child in need to all the way up, and across to private fostering arrangements and everything that's in between, including children on a child protection plan, child protection conferences, etc. That's all in that standards and criteria. We've also got new procedures for child protection inquiries and the procedures for child protection conferences and plans. And then there's also the child protection conferences, a guide for parents and carers that we have on the NYSCP website. And then also there is the guidance on professional curiosity, which I'd already mentioned. And all of that is available from the procedures, practice guidance, 1 minute guides page on our website, and the link is on the screen there. In terms of multi-agency responses to children living with autistic spectrum disorder, autistic spectrum disorder is a condition which many people are born with and first manifests when they're a very young age. It is in itself, autism is a lifelong developmental disability which impacts how many people will communicate and interact with the world around them. And 1 in 100 people are assessed to be on the autistic spectrum, and it's estimated that there are around 700,000 autistic children and adults just within the United Kingdom alone. Sorry, my screen. So autism can affect people in different ways. People with autism can have social and communication and social interaction challenges. They can have repetitive or restrictive behaviours in how they act, and over or under sensitivity to a variety of different things, which could be light, sound, taste, touch. It's that stimulus of the senses can be they can be very susceptible to that. They will also have, generally speaking, highly focused interests or hobbies, and may also suffer from extreme anxiety as well. And when everything becomes too much for an autistic person, they may become completely overwhelmed by their current situation, and this can mean that they lose the ability to control their behaviour, and may do things that would concern us, either hurting themselves or other people. Or another response might be that the person becomes completely unresponsive and will not speak, move, or anything else. So it's a variety, and it depends upon a case-to-case basis how that would pan out for a child or a young person suffering from this disorder. There are a number of considerations to think about when you're working with a child with who has autism. They could have difficulty in telling someone that they're experiencing abuse, particularly if they have communication difficulties, which can be very challenging to understand their concerns. Professionals need to consider how they can understand the voice of the child as part of that whole safeguarding process. So, consider the language and the understanding of the language by the child. Just repeating words or phrases does not necessarily mean that the child has an understanding of the meaning of what that is. There could be indicators of abuse, such as withdrawal from the social situations, or various different other things may be misrepresented as a consequence of a young person being autistic. A change in behaviour may be indicative of a child who is distressed or upset for some reason, and whether the professional has the appropriate skill set to communicate and work with a child or a young person who is on the autistic spectrum could also be a very significant issue as well, just because of that specialist form of communication that you might need there. And whether to use an intermediary is also a consideration that professionals should be thinking of to support the work with the child or the young person. A number of the children will also have multi-agency plans. These might also include the NYSCP plans or child in need plans. They will already be in place, and any planning processes which involve this child will need to take into consideration those plans, and they may need to be reviewed in light of what else is going on in terms of why they've been referred. And how are the specific needs of the child being addressed in terms of the safeguarding process is also a key consideration as well. So in terms of audit findings, the areas that we found that were going well, the first one was about timeliness. There were prompt and timely multi-agency responses to all of the cases in terms of the concerns that were raised. So this, the concerns were recognised, the fact that the child was autistic was recognised, etc. as well. Working with the family, here we were looking at things like the good practice recognised in working with families and keeping parents informed, and reassuring the parents of the next steps and if a re-referral was required as well. Obviously these cases we were always looking at over the COVID-19 pandemic sort of era, and despite the fact that of the impact of COVID-19 pandemic, face-to-face visits were carried out, albeit restricting the wishes of the family and ensuring appropriate arrangements for social distancing. That might have also included things like meeting people outside rather than within their own homes, wearing masks, all of that sort of thing. In terms of the single view of the child, information provided within the audit from the Children and Family Service did highlight a piece of work that's currently ongoing to look to join up around different plans for children through the local authority systems, and it was felt that that was going to be a big help in the future. And then the multidisciplinary working, there was, again, as with the previous audit, good multi-agency disciplinary working across partners, particularly health partners, in relation to the assessment of autism. We also had evidence of good practice with the early help and an inclusion service at the point of an elective home education as well. So there was good multi-agency working all the way around, and there was also good multidisciplinary working within health as well, because obviously health has a variety of different disciplines under its wide banner. The areas for development, again, and as I said, you will see this as a theme, professional curiosity, again, was highlighted as an area to be improved upon. Practice supervisors need to be more curious where a child's got autism during a 10-day discussion with workers to ensure that a range of multi-agency views and specialists information have been sought for children with additional needs, and will be included within the assessment. The inclusion of all relevant partners in meetings was also an issue that was identified for improvement during this audit. While we had good multi-agency attendance, it's important to ensure that all relevant partners are included in the strategy discussions, in the assessments and the planning processes in order to ensure that meetings are informed and appropriate actions are identified. So, for example, where a child attends a special school, ensuring that the specialist school nurse is included and invited to the meetings, because that for some roles like that wasn't necessarily the case. The recording of information was highlighted as an area of development. Here, recorded on local agency case management systems and in related documents included minutes of meetings were not always clear about which agencies have contributed to the assessment and the planning and their level of contribution within the process. So that's an area for development in the future. The issue about children being invisible to services, where a child on the autistic spectrum is electively home educated, they can become invisible to a lot of services if none are being provided. So it's important for organisations to have a clear record of any involvement that they've had with a child to ensure that this information can be shared if needed as appropriate. Training and support for those working with children with autistic spectrum disorder. Here we were looking at the Assess and Supported Year, or ASYE, social workers need to access information and training around the autistic spectrum disorder to ensure that they're better equipped to support parents and children. It was noted as part of the ASYE, there is a session on special educational needs and disabilities, and there are courses for autism awareness and unlocking autism, and this includes a webinar and a 2-day session for people to attend as well. The impact of moving to a large mainstream school. This is an area that we did identify as part of the multi-agency audit group, because it was noted that the move from a small specialist school to a large a mainstream school for a child with autism would be very significant for them, and may feel quite overwhelming for a child, and the need to ensure that they're appropriately supported for the transition was also highlighted. And that does go on in terms of, there are like stepping up sessions for moving from primary to secondary for children with anxiety or whatever, but it should also be included for children who have autism if they're going into a mainstream school. Schooling options is another area for development, and here it's talking about schools should explore different options with parents for supporting children to meet their needs in different ways, which may include other options to elective home education, so that they do still keep under the banner of the school and that the child can still receive their education. Missing fathers was another area of development, and there was the need to ensure that the assessment process includes the views of missing fathers or absent fathers. We do have training on our YouTube channel that we held a conference about a year ago, which related to working with fathers, and there's a lot of information there about the best practice, how to do that, etc. So I would suggest that you look at our YouTube video. Kat, would you mind just putting a link into that video in the chat for me, if that's okay? So what have we done? Again, the subgroup always develops an action plan for these things, and we've shared that information as well. The practice guidance for professional curiosity has also been reinforced here through various training events. And we've also been looking to raise the awareness with fathers, and also we are presently working with the City of York Safeguarding Children Partnership to develop practice guidance specifically in this area. So that will be something that we will be bringing to a future masterclass, so that you can learn more about it as well. The resources, again, a lot of these are very similar to the previous ones. There is the framework for decision making, right help, right time at the right person, worried about a child, the standards and criteria, and professional curiosity, practice guidance. If Kat hasn't already put it, I can't see the chat at the moment, but there is the Working with Men conference, and there is the link on the screen as well. I forgot to put that in, so apologies, Kat. And to access all of this information, just follow the links that will be on screen. We will put this in the description for the YouTube video as well, so you'll be able to download it there also. The last themed audit which we had related to the multi-agency responses to neglect, or children experiencing neglect. So when we talk about neglect, here we're looking at the persistent failure to meet a child's basic physical and or psychological needs, which are likely to result in a serious impairment of the child's health or development. Neglect can occur during pregnancy as a result of maternal substance misuse. Once a child is born, neglect may involve a parent or carer failing to provide adequate food, clothing or shelter. This includes exclusion from home or abandonment. protect a child from physical or emotional harm or danger, ensure that adequate supervision, including the use of inadequate caregivers, and also failing to ensure appropriate medical care or treatment. It may also include neglect of or unresponsiveness to a child's basic emotional needs as well. So it's quite a wide-ranging term, is the term of neglect. So there are many forms of neglect that we can have. We can have medical neglect. So this is where the child's health needs are not met, or they are not provided with appropriate treatment as a result of their illness. So, you know, for example, not taking the doctors when they're required to, not providing prescribed medication, and that sort of thing. Nutritional neglect is another area. Here, this is usually associated with inadequate food for ensuring the normal or leading to the normal growth of a child, and this is also known as the failure to thrive, or is now referred to as faltering growth. In terms of emotional neglect, this is neglect which can involve deliberately trying to scare, humiliate, or isolate or ignore a child. Any of those would be considered to be emotional neglect. There are obviously other examples in relation to that. Educational neglect basically includes where the parent or carer is failing to comply with the state requirements, but also includes the broader aspects of education, such as providing a stimulated environment, showing an interest in the child's education and support their learning, including that any special educational needs are met. When we talk about physical here, we are talking about neglect that refers to the dirty state of the home, lack of hygiene, a lack of heating, inadequate and or broken furniture or bedding, and then failure to provide supervision and guidance. This refers to the carer failing to provide a level of guidance and support to ensure that the child's physical safety and that they're protected from harm. We do actually have guidance for parents on our website in relation to when can a parent leave the child at home alone and that sort of thing. And I know that we have had some issues in the past with early help about people leaving a child overnight on their own when they're too young to be left alone. So when considering things in relation to professionals, if a child is experiencing neglect, what you need to consider is the child neglect not only affects the young children, but profoundly impacts this the significant age range of 11 to 18-year-olds. Neglect may arise from a lack of knowledge, competing priorities, stress or deprivation, and using an early help approach to start a conversation with the right people to identify how how help can be provided is a good way to start. But what we should always remember is that poverty is not the same thing as a neglect. You know, with the way that the world is at the moment, parents who are doing the best but can't provide everything for the child, that's not neglecting them as long as they're meeting the basic needs for that child. Recognition of neglect here, it was noted that although one case presented as acute neglect rather than as a more longer term presentation, practitioners were always very quick to recognise and respond to neglect of the child. In terms of communication, the audit group noted that the practice in communicating with families was very good, and for children in schools, it was noted that a school has been very positive and happy place for a child to be. In terms of early help, there was evidence of good engagement with early help and services to support the family and the child. And engagement with men, there was good practice, was identified with regards to the engagement with the child's father and the wider family support network in the assessment and the provision of support. However, it should be noted that in some cases, despite professionals' attempts to engage fathers, the fathers didn't always do so. There was also evidence of good quality attendance at meetings and a positive engagement with schools, which led to, you know, a quality of joint working across professionals. And in terms of assessment and planning, there was evidence of good multi-agency engagement with assessment and planning and the production of some dynamic plans for the children and young people, which had an impact on the outcomes for those children. In terms of areas for development, the recognition of substance misuse was identified. This the audit group did question one case whether a mother's substance misuse could have been identified at an earlier stage and that service would have been provided, which would have obviously meant less impact on the child. We do have, currently in development, we have new guidance in relation to parental substance use. We are dropping the miss part of the title, but that guidance will be out in the next few months, so that will be one that you might want to keep an eye out for. The quality of referrals, and in some cases the quality of referrals could be improved by providing more background information to support the risk assessment process, because obviously understanding the history in relation to the child really does help in terms of assessments of what's worked well, what hasn't worked well, and what needs to change. And in terms of quality of referrals, we will be running a quality of referrals masterclass, pardon me, in July, which will look at how to improve your referrals. So if you want to sign up for that one, I would suggest that you put your names down for that now. That's available to book on our website. Child protection medicals, the strategy meeting should consider child protection medical assessments for cases where neglect has been identified to ensure that the health needs are addressed and identified for the child as well. So that was a consideration for the child protection conferences, or strategy meetings rather, right from the start. And then focus on the voice of the child, and in some cases the focus of the voice of the assessments was more about working with the parents rather than what the child was trying to say or what was best for the child. So there needs to be that focus in terms of what the child's needs are and meeting those needs. Normally that will meet with identifying and resolving issues between parents, but it's not always the case. In terms of strategy meetings, where a physical harm disclosure is made in the context of neglect, then a strategy meeting should always be considered along with a child protection medical assessment. And in terms of dental hygiene, poor dental hygiene can be a sign of ongoing neglect, and professionals should be aware of dental neglect and prompt dental assessment for vulnerable children. You know, things like missed appointments for dentists, that sort of thing is a good sign of potential dental neglect. In terms of what we've done about it, again, this has gone through the subgroup. All agencies involved in the audit have had the feedback. We've updated the practice guidance in terms of substance use with parents, and The NYSCP has also been working with City of York, the same as the other audit, to develop that whole working with fathers practice guidance as well. That, I think that will actually be a little bit more wider in the long run, because we'll also look at same-sex couples, and also where grandparents are acting as like a parental figure or a significant figure for the child as well. In terms of useful resources for decision making, again, it's a lot of it is the same sort of stuff as well, but we also have practice guidance in relation to neglect, which again is available from our website as well. But obviously there's a normal standards and criteria decision making framework, worried about a child, and professional curiosity guidance. So that's it in terms of the multi-agency learning. And before I go on to the NYSCP update, does anybody have any questions in relation to any of that? Don't think there's anything in the chat. Okay, so we'll move on to just a brief update from the partnership. In terms of procedures, guidance and 1-minute guides, we have updated the standards and criteria. That's now available on our website. Obviously, we've talked about that quite a lot already. The missing from home and care protocol has also been updated. You can access that from the website. The safeguarding practice guidance in relation to unborn babies, the pre-birth guidance is available, and there is also new information for Safer Sleep Day 1, a professional's guide. You can look at that, but we also have our own practice guidance, which has been developed through our CDOP work. We also have a guidance notes for child abuse linked to faith or belief, including witchcraft. This was highlighted from an Ofsted report, which did actually look to, did comment in terms of what guidance was given to families in relation to faith and witchcraft. So we developed this guidance on a quick turnaround for making sure that that's available for everybody. And there's also been the updated guidance for child exploitation as well, which you can access all from that link that's on the screen there. I'm sure many of you will already be aware that from the 1st of April 2023, the main customer service line for the new North Yorkshire Council has changed. The new number is 0300 131 2131. This is replacing the old 01609 780 780 number. So this, and it also would cover out of hours emergency duty team calls. The contact number for the customer resolution centre and that is still available, the 780 780 number, but that will be phased out, and we want to phase it out as soon as we can. So please make sure that any references in your policies or procedures locally do reflect the change in number and do not reflect the older 780 780 number. Things like the professional consultation line hasn't changed. It is just the main line to make a referral or get early help. So the 01609 535 070 is still the professional consultation line. You don't need to update that one. I also just wanted to draw your attention to the fact that the NYSCP YouTube channel has been developed and branded. We have a new logo, which is different from the other ones that we use because it's circular, because a lot of social media, well, all social media sort of like logos seem to be circular. Due to the requirements for that, this is why we've made this change. This new logo is only for social media, so you won't see it on other publications. That will still be the standard logo that you would see. Our YouTube channel has also changed. If you've been to these presentations before, you know that the YouTube channel was youtube.com/UCU and then a load of different characters. That's now changed so that it's now youtube.com/ and then the @ symbol like you would have in an email, NYSCP, and you'll be able to see all of our videos there. We do have quite a number of training courses on there now. There are also playlists for the latest masterclasses, for information for people working with children, information for children, information for parents. There's lots of information on that channel. There's some really very good presentations, such as we had an excellent presentation about working with families from the Ukraine. We had that in December. We've had interesting information about the recent Growing Up in North Yorkshire survey. Our own Kat has delivered some presentations in relation to child exploitation and the MACE arrangements, which are all very good as well. And there's also things like the school designated safeguarding leads network meetings, which you can access as well. It's all free of charge to be able to access. We also have our new podcast channel, which you can access. It's changed from the old one. We used to be on Anchor FM. Anchor FM was bought out by Spotify, so we're now available on Spotify, so you can actually listen to our podcast there. And we do have a new podcast that is coming out. That podcast is going to be looking at the dark web and what you should know as a professional. And that will also be a YouTube version of the same recording as well. So if you want to listen to it in the car, download the podcast. If you want to watch something with information on there, then have a look at the YouTube channel whenever you're available to do that. That'll be be available to you in the very near future. So just keep an eye out for that as well. In terms of upcoming masterclasses, we have Making a Good Referral, which is our next masterclass. So if you want to improve your skills for making a referral, please subscribe to that one. That will be headed by Hannah Ellingworth, who is our partnership manager. In September, we've got one on social, emotional and mental health. We then in October have our masterclass for reducing parental conflict. If you're a childminder or your childcare provider, there is actually going to be an evening masterclass specially arranged for nurseries, preschools, that sort of thing. And then in November, Kat will be presenting her multi-agency child exploitation masterclass. We do have one for December, but I'm sorry I can't remember what it is at the moment, but I will make sure that that's communicated to everybody as well. To sign up for all of our training, just go to our training page. If you go to safeguardingchildren.co.uk and then move your mouse over the professionals word in the blue ribbon, and then a sub menu will appear, and just go to training, and that will take you to that link on that page there. Again, all of our masterclasses, apart from a couple, I think we've had 3 masterclasses that have not been recorded. 2 of those have been because it's this counter-terrorism local profile and it's not appropriate for us to put online, and the other one was because it was a presentation from Halo which was copyrighted, so we couldn't reproduce it. But other than that, all of our masterclasses are available for you to be able to use free of charge as well, and you can share that with your colleagues also. Here are the key main links that you will need in terms of the partnership. So our website, safeguardingchildren.co.uk, our Twitter account, which is NYSCP1 on Twitter. If you want to find out the latest information, we publish things on there on a daily basis, basically. We have a Facebook group, NYSCP1 as well, and then our YouTube channel and at NYSCP on YouTube, which I've already mentioned, and our Spotify account. Also, we produce a monthly e-bulletin. That e-bulletin is available from that link there. You can sign up for that, and then you will get on the first working day of every month the latest information from the partnership, which we will distribute to you. In terms of a masterclass on attendance, we haven't had one yet. However, in terms of that, what we might we are looking at doing is having a school conference in October, like we had for designated safeguarding leads last year. We're just looking to locate a venue and a date for that. Unlike the previous conference, unfortunately, we are not able to fund this one, but there will be an early book, early bookers fee, which will go up after the first 100 tickets that are sold for that conference. But one of the things we are talking about doing that would be looking at attendance as well. But I will raise that as well, as if that's something that you would be interested in hearing, then we can certainly do that. And for anybody who is working in a school, we want to hear from you for the type of speakers that you would like to see, and workshops that you would like to have at the conference as well. Certainly one of the things that we are considering is going to be in relation to harmful sexual behaviours as one of the core themes, and also parental conflict as well. So those will probably be two of the key themes that will be coming out of the conference, but there will be others, including online, child exploitation, all of that sort of thing as well. Yes, so that's another thing to remember as well. On the 19th and the 23rd of June, we also have our safeguarding week. On there is going to be a number of presentations. I will be giving a presentation in relation to the dark web. I will also be giving a presentation into what professionals need to know about streamers. Kat, I know that you have a session on child exploitation. Do you want to talk about that one very quickly?
Yeah, sorry, couldn't find the unmute button there. Yeah, okay. So I'll be delivering 2 sessions during Safeguarding Week. One of the sessions will be looking a little bit in detail at some of our MACE processes, and we're going to be having some kind of discussions around disruption and what disruption can look like for partners across North Yorkshire. And the other masterclass I'm going to be running is a learning event facilitated by many of our wider partners, looking into the Child Protection in England review and what we've been doing as a partnership over the last year, looking at the document.
Thank you, Kat. So there's lots of good stuff there. Sam, you've asked about how do you book onto the next masterclass. If you go to our website, safeguardingchildren.co.uk, and then move your mouse over the word professionals on the blue ribbon, and then go down to training in the sub menu that's there. You click on that, look for the masterclass that you want to join. I presume if it's the next one you want to do the referrals one, there is a book here link on the drop down for each of the titles, and then that will take NYSCP so that you can book onto the masterclass that way. And that's the same for all of our training events as well. If you want to book onto the events that are going on through Safeguarding Week, then you will need to book on using Eventbrite, which is a different link, but we can provide details of that as well. Okay, if nobody else has any more questions, I would just really like to thank everybody for attending today. I'd like to thank Kat for assisting me in the masterclass as well. I hope you found this really useful. Don't forget there is the 7-point briefings for all of these audits as well, and that's available on our Learning for Professionals page, which again is from our website. And don't forget this masterclass will be uploaded onto YouTube, so you can share this information with colleagues as well. Please do so. Thank you very much.